Hi, everybody. My name is Dr. Brian Bushman. I'm a clinical psychologist working at the Counseling Center here in Centerville, Utah. I've been working with folks, a lot of kids and adolescents, for about the past 15 years. I'm excited to share a couple of ideas with everybody today. Hope that you find them useful. Let me share my screen with everybody and we can kind of get going. Okay. All right, so here is my contact information, including website. If you have follow-up questions, be happy to hear from you. As the title mentions on here, which is my Harry Potter play on words, it's mainly geared towards helping elementary age students that have some behavioral problems. Now, I do think a lot of the stuff that we're going to talk about could also apply to junior high and maybe even a few high school students, but wanted to let you know who the presentation was for. So if you're wondering who exactly and whether or not this is worth the time to spend watching this video, here's basically the child that we're talking about. The child that you may have in mind, either maybe your child, maybe a grandchild, maybe a student, is they're probably a child that doesn't mind. We call that non-compliance. You basically ask them to do something and they do one of three delay strategies. They either ignore you, they argue with you, or they have a tantrum. Now, all three of those techniques are just three ways of delaying consequences. And so they all fall under the category of non-compliance. And chances are, if you're watching this video, the child you're thinking of probably sometimes struggles with non-compliance. Another thing that may describe them is that they're probably argumentative, or they have a little bit of an attitude when they're upset. Another thing is they probably don't focus very well on when you give them a task to do, at least on things that they don't enjoy. Now, a lot of times parents will come to me and say, well, I don't think my kid has ADHD because they can play Roblox or Legos for hours and focus on that, but they can't focus on their homework to save their life. That actually does not mean that they don't have ADHD, because ADHD is the frontal part of the brain that helps us focus when we have a task that is not intrinsically exciting or reinforcing. So chances are the child that you're thinking of maybe doesn't focus very well. And then fourth, they probably don't handle transitions very well. Now here, I'm defining a transition as you're trying to get them to stop doing something that they like and start doing something they don't like. So you go up to Johnny and you say, hey, I need you to stop playing Legos and I need you to start getting ready for bed. That would be an example of a transition. So chances are the child that you're thinking of for this course probably has one or more of these characteristics in mind. If one or more of these characteristics describe the child you're thinking of, then you're watching the right video. But let's spend a minute talking about what might be driving some of that behavior that we find so obnoxious and so difficult to deal with. For some of the kids that have these kind of behaviors, what could be driving it is something I alluded to before, which is ADHD problems, also referred to as difficulties with executive functioning. Again, that's the frontal part of the brain that helps us focus and helps us with impulse control. And so kids with ADHD, both ADHD and what used to be referred to as ADD, can have some what seem to be just defiant behaviors because they have such difficulty controlling impulses and focusing themselves. Another thing that could be driving the behavior is you probably have heard terms like oppositional defiant disorder, or ODD. In my opinion, ODD is basically a wastebasket diagnosis. I mean, it has some validity in that it basically says a kid is defiant, but it doesn't say why they're defiant. And sometimes maybe they have a hard-willed temperament or something along those lines. But I see kids with ODD who have all kinds of problems. Sometimes they have anxiety underneath it, or mood problems, or trauma. But one way of dealing with the world, a way to cope with the world, is to basically just say no. and get in that habit and that pattern. Another factor that could be driving it is trauma. Kids that have seen some really scary things, especially before the age of 5, sometimes much before the age of 5, can develop some difficulties with attachment. They don't know how to feel safe among people, and so being defiant is kind of a way to cope with that trauma. There are also some kids that have learning problems. If you're in 3rd grade and everyone else seems to understand reading, but you don't, saying no and being defiant might be a way to deal with that learning problem. And then lastly, kids that have some anxiety or mood problems can also present as being very defiant as a way to just cope with the world. Now, we won't spend a lot of time on diagnosis today. It's not because that's not important, but it's because it would just take too long. So I'm going to shift really quickly to practical things that you as a parent can do to help these kids. Now, I'll focus for the next little bit on how you respond as a parent or as a caregiver. Now, that doesn't mean it's all your fault. Let me be clear about that. I've met a lot of kids that I thought came from really great families who struggled. But I have the most leverage with parents, so I'm going to focus on your behavior, but I don't want that to imply that you're a messed up parent and they're a messed up kid. You'll also notice that on this slide, there is no section here as far as an explanation of what's driving the behavior, that they're a spoiled brat. Those kind of labels, generally, the only thing they do is just upset parents and make it more difficult to do some of the things that we're going to talk about. All right, so before we begin, I want to reference a book called Good Inside by Dr. Becky Kennedy, where she talks a little bit about some what she calls the parental bill of rights. These are some good mantras for you to say within yourself so that you can keep it together when your child is not keeping it together. Good behavior management for kids means there's good emotional management for parents. If parents can't manage their own emotions, they're not going to be very successful at helping their kids manage their emotions. So here's a couple of mantras that she recommends. First, I'm a good parent who's having a hard time. They're a good kid who's having a hard time. I and my child can make mistakes and learn from them. I believe that. I believe in having a growth mindset instead of just labeling people and putting people in boxes, including the labels we give ourselves as parents. Second, I have permission to take care of myself, even if others are inconvenienced or if others disagree. Parenting is not a sprint, it's a marathon. And so you're going to need to take a breather. You're going to need resources. You're going to need people to help support you because doing it by yourself can be very, very difficult. Next, I need my kids' cooperation, not their emotional permission to parent. Kids will a lot of times say, well, I don't want to do that. And my tongue-in-cheek response is, well, good news, you don't have to want to do it. You just got to do it. I mean, there's a lot of things that I don't want to do, but I end up having to do it. So don't feel like you have to always get a child's emotional permission in order to parent them. And we'll talk a little bit more about that. Next, being close to your kids doesn't mean you're always going to be their favorite person. In fact, a lot of the times, if you're doing your job as a parent, you will be among their least favorite people. And then finally, being fair doesn't mean treating everyone exactly the same. Jimmy Johnson, who was the head coach for the Dallas Cowboys back when the Cowboys were good, said it this way. He said, I'm 100% fair. I treat everybody different. Don't feel handicapped like every child in your family needs the exact same treatment, because chances are some of their behaviors might qualify them for certain treatment. And if you allow them to, they'll guilt you into thinking that you are somehow being unfair, when in fact, you might be 100% fair by treating everybody 100% different. And sometimes that's okay. I'm not saying we should show favorites, but I don't think that should necessarily make you an emotional hostage. All right. So now that I've talked a little bit about how we can manage or start to manage some of the guilt that we feel inside and some of the anger we feel inside, although I could spend a lot more time there, let's talk more practical. And here's the question that I begin most of my sessions with when I'm starting to work with patients. And it's this: have you ever gotten into an argument with a drunk person? Now, even my parents that don't even know what beer tastes like knows that this is kind of a no-win scenario. It doesn't matter how right you are or how wrong the drunk person is. The only way to win that argument is to basically say, you're drunk. I'll talk to you when you're sober. Bye-bye. And end the conversation as fast as humanly possible. If you don't do that, then the problem is you'll end up getting into basically a drunk brain conversation with them. And part of that drunk brain conversation is going to be that you'll start saying drunk brain things yourself. Like you'll start saying that Christmas is going to be canceled of some kind. And that's not going to end very well for anyone. So a couple of things to think about is that if somebody is intoxicated in front of me, I don't take seriously what they're saying. And, the only way to really win that argument is to basically say, let's talk a little bit later. And if you say anything more than that, you're on dangerous ground. Now, I know we're talking about elementary students here, and I hope none of them have actually tasted beer, but I hope you also see the parallel that I'm talking about. There are some situations where your third grader or kindergartner even is like 5 shots of Jack Daniels drunk, and you need to say as little to them as humanly possible. Now, here are your 3 drunk brain scenarios, okay? I'll go through them really quickly, then I'll give you an example of each. Drunk brain scenario number 1 is when your child just heard the word no. They wanted something, they don't have it, but they wanted it, and you said no, or they're kind of fishing for attention. Drunk, okay? Second drunk brain scenario is when your child was just asked to do something that they hate doing. Basically, you want something. The first drunk brain scenario was they wanted something. Now you want something. And so examples here could include either commands or transitions. Okay. So transitions we talked about before, they're doing something they hate or they like, and you're trying to get them to do something they don't want to do. Or a command is just asking them, please make the bed. Okay. So drunk. And third, when they're busted. They know the rule, and you basically caught them with their hand in the cookie jar, so to speak, and they feel shame. Don't underestimate the power of shame. And we'll talk a little bit more about this, but we don't want to rub a kid's face in the mud. All right. Let me go through 3 clinical examples of why this is so important. Okay. So the first situation here is when the child just heard no. Okay. So let's say that you got a 12-year-old and she wants to go to a party, but you don't know anybody there. And you say to her, no, I'm sorry, you can't go. We don't know anybody. Okay, so far, so good. That's great parenting, right? But unfortunately, the parent stays in the room to try to get the drunk brain 12-year-old to agree with them. In other words, they're trying to get the 12-year-old's permission to parent. Now, this is a big mistake. What I would like for that parent to do is say, look, I know you're upset. I love you. We made up our minds. We'll talk to you later. Bye-bye. Right? Because that's what you do with drunk people. But that's not what happens. Instead, the parents stay in the room and they plead their case to a drunk brain kid. And then what ends up happening is the parent gets drunk and things escalate, right? Until eventually the mother calls the 12-year-old a bitch. And then what ends up happening is the 12-year-old comes into the next session with me and she doesn't say, hey, Brian, my mom and we got into like a little bit of a tiff, but we all say things that we don't mean. And she happened to say the B word. That's not what the kid says. Instead, the kid comes in and says, my mom called me a bitch. And then I have to spend 5 sessions cleaning that up, all because the parent doesn't know how to swallow their pride or swallow their anxiety and get out of the drunk brain conversation. This is a problem. Okay, example of drunk brain scenario number 2. Kid hates doing math, right? So 3rd grader, let's say, parents go and pick him up from school. The kid's all happy. Everything's going great. He's at home. He's got his snack, his juice, things like that. And the parent comes up to him and says, hey, Johnny, it's time to start math. And Johnny, oh, eye rolling. But the parent doesn't pay attention to that, wisely enough. And they're sitting there trying to do math. And Johnny's throwing a bunch of crap against the wall, seeing what sticks. When am I going to use this? This is dumb. This is stupid. And the parent wisely ignores all that and says, we'll talk about that later. Do problem number 2, please. Okay, so far, so good. I like what's happening. And then the following thing happens. Then Johnny's there kind of saying, oh, this is so dumb. And you know how I said kids throw crap against the wall and see what sticks? Well, at some point, Johnny just miraculously on his own says, oh, it doesn't matter. All the kids hate me anyhow. And let's say the mom is sitting with him and suddenly she has her own history of being bullied. And she puts down the pencil and she says, what do you mean the kids don't like you? Is somebody bullying you? Yeah, they are, Mom, now to mention it. And now the pencils are down. And now they're going to have a 5-minute conversation about whether or not kids are nice to Johnny. Right? Now, what are they not doing? They're not doing math. Right? Now, at this point, it's the parent who interrupts me and says, but I can't ignore that. My kid might be being bullied. Okay. Remember how before, when the kid was throwing crap against the wall, you wisely said, well, thanks for letting me know that. We'll talk about it later. Do problem number 3. That's the exact same thing I want you to do here. Okay? Just do something I call connect and redirect. You validate and say, oh, that sounds tough. We'll talk about it later, and get through math. Because isn't the timing suspicious? Remember, Johnny was happy as a clam when he got home from school. He didn't have any complaints about people bullying him. And you're telling me that just now, while you're trying to get him to do something he hates, he now wants to talk about being bullied? Now, notice I'm not telling you that you should say to Johnny that he's a liar and full of it. No, that's not going to go anywhere. That's just going to lead to a drunk brain conversation for both of you. No. Instead, say, thank you for letting me know. We will address it. Go ahead and do problem number 3. And then later, after math is done, then go up to Johnny and say, hey, it sounded like before some of the kids weren't very nice to you. Would you like to talk about it? I tell you 90% of the time, Johnny's going to be like, no, it's cool. Can I go play now? All right. So that's why drunk brain scenario number 2 is important. Third, when they're busted. You walk in, you find your 14-year-old smoking pot, and you say, what are you doing? And this kid suddenly says, I don't know. It isn't mine. I don't know how this got here. It must be yours. And the parent stays in this drunk brain conversation about pot and how it's going to rot their brain and how all this is going to happen, everything else like that. And soon the kid turns the table. Well, I wouldn't have been smoking pot if you and dad hadn't have gotten a divorce. And now we're in a way drunk brain conversation. Why? Because the kid's busted. The kid feels ashamed. And so now they're going to throw a bunch of crap against the wall and see what sticks. Now, notice I'm not telling you to excuse the pot smoking, right? But if you stay in the room, you're sooner or later going to feel like your child needs an IQ test because they're going to say some really dumb stuff, okay? Don't believe it. They're drunk. They're drunk. Don't get drunk with them. It's fine for you to say, look, I know what you're smoking and there's going to be a consequence. You take the joint, you say, I need to go cool down. Your mom and I are going to talk. We'll talk later. Bye-bye. You get out of there. Don't worry. We will talk about consequences. But this is about not being invited into a drunk brain conversation that isn't going to end well. All right. Now, sounds easy, right? Not so much. And here's why. You are going to have your own impulses in this moment. And by the way, no judgment. I have been there. I've made each and every one of the mistakes we're going to talk about next. But good behavior management is really about managing the impulses that we have as caregivers. And here are the big 3. The first one is what I call the teaching impulse. This is also known as defending yourself. Okay. What this is the kid says something drunk and we feel like we have to set them straight. It's like we want to shake them, right? Now for men, and I'm stereotyping here a little bit, I hope you'll allow that. For men, the problem is pride. I never would have gotten away with talking to my dad like that. That's pride. It's pride. And for women, not always, but sometimes, it's anxiety. Oh, I can't let them think that. Don't worry, they don't. They're drunk. You don't win an argument with a drunk person, do you? but you're going to have this teaching impulse, and it's going to be like diarrhea of the mouth. And you're going to have to push that down deep, deep down until your tummy hurts sometimes, so that you don't end up getting drunk with them and doing something like claiming that you're going to cancel Christmas or something else dumb that you can't follow through on. Quick side note, a lot of the parents I work with feel very guilty for being inconsistent, but you know why they feel inconsistent? It's because they get baited into drunk brain conversations, and when they do, they say stuff that they can't follow through on, and then it puts them in a horrible position of backing out of it later. So the best way to get out of that is to prevent it from happening in the first place, and that includes not getting pulled into that teaching impulse. So here's probably the most important thing I'm going to say to you for the next little bit here. Teach when the relationship is good. Never teach when they're drunk. I'm serious. I know you feel like they need to be taught. Shut up. I know you feel like if you don't say something, you're going to explode. Shut up. Seriously. Shove it down. You can teach later when the relationship is good. I promise you. But don't teach when it's negative. Because if you do, the only thing that's going to happen is your child's going to associate your teaching with being busted. And then even if you've got the wisdom of Solomon, they're going to do the opposite just to spite you by the time they're teenagers. Look, they're not able to hear you anyhow. Why? They're drunk. And do you win an argument with a drunk person? You do not. We got to pick and choose our battles. A lot of the times it's not what you say, it's when you say it. And here it's about teaching when the relationship is good. So that's one impulse you got to be aware of within yourself if you're going to be a caregiver. Second impulse is the control impulse. This is the part where we want to threaten. Young man, young lady, if you don't do it, then I'm going to da-da-da-da-da. And a lot of times the da-da-da-da-da is drunk brain stuff that we can't follow through on. But we also can't help ourselves because we're either feeling prideful or we're feeling scared. And the final impulse is the let sleeping dogs lie impulse. What this means is if Johnny isn't being a pain in the butt right now, let's just leave him alone. Well, the problem with that is Johnny only gets attention when he's misbehaving. And there's no way to repair the relationship. We just end up avoiding each other. So instead, what you have to do is you got to catch Johnny being good. You got to find some times to give him attention and to be very interactive and engaged when Johnny's being good. By the way, another side note, I don't want anybody watching this to think that the moral of the story is to just universally ignore your kids. Of course not. I want your kids to have plenty access to your attention and to your time, and yes, even to your teaching. I just don't want you to spoil it by doing it at the wrong time. All right, so let's go through our drunk brain scenarios one at a time. Be very pragmatic now. Let's go to drunk brain scenario number 1. Quick reminder, this is a situation where they want something. They're asking for something and you have to say no, or they're doing something to push your buttons for attention seeking, okay? So instead of getting into this dueling banjos things where you try to like one-up each other, I'd like for you to experiment by doing the following instead. When your child is doing okay and the relationship is good, you're going to do some teaching. Because again, you can teach when the relationship is good. I want you to go up to your child and say, look, there's too much arguing at home. And so we're going to have a new rule. And the new rule is good voice, good face, good words. If you can show me good voice, good face, good words, then I'll stay and listen to you. I can't promise you that I'll agree with everything you say, but I can promise that what I'll do is I will try to hear you out. Now, you'll have to practice with them what that means. Now, good voice means this. This is bad voice. As soon as they start to yell, you're gone, okay? What does good face mean? Good face means this. It doesn't mean you have to be smiley all the time, but this is bad face. Or this, like where they're fronting with their body in some way. You can't really talk to somebody who's doing that to you. And the third one is good words. You'll say to Johnny, what is good words, Johnny? And Johnny will be like, don't cuss. You'll be like, yeah, that's part of it. But also what it means is good words are I feel words. Like I feel scared, I feel upset, I feel angry. Those are all good words. Bad words are you hate me, you don't love me. These attention-seeking kind of dramatic statements. You got to let the kid know when the relationship is good that those fall into the bad words category. And if they're not showing good voice, good face, good words, you're just getting into a drunk brain conversation. And no amount of teaching or coping skills or medications are going to help a kid who has learned that escalating works. In other words, escalating gets parents and caregivers back in the room. Now, the kid, because you're teaching them when they're not drunk, they'll say, oh, okay, mom, dad, whatever. But in the moment of choice, it'll be different. So Johnny comes up to you, says, hey, can I get on Xbox? And you say, sorry, you can't do that right now. We're about to go to dinner. And he starts to escalate. He starts to yell. He starts to say why. And you have the teaching impulse, right? Like you're going to stay in the room and teach Johnny, something else, right? You're going to teach him. No, you push that down, you push it aside. And instead of trying to teach Johnny, which you've already done, 300 times by now, or you wouldn't be watching this video. Instead, you look at him and you say, Johnny, can you please say that differently so I can stay? Okay. Now, if Johnny tries to calm down, he's not going to be a perfect angel. Let's not sugarcoat this. But if you can tell he's breathing, he's trying to calm down, then by all means stay and provide him attention. It's good attention, right? Hey, Johnny, thank you so much for talking to me that way right now. I really appreciate it. Love you, buddy. What can I do to help? But there's a 10-second rule. If Johnny isn't attempting to use good voice or good face or good words, because it doesn't, any of those three, if Johnny's not doing those three things within 10 seconds, you don't have to yell back. You don't have to teach. You can just say, look, you're having a hard time right now. We'll talk more about it later when we're all calm. And get out of there. If your feet stop moving, you've lost. Okay? You've just been hooked into the teaching impulse and you're going to go in and give him a piece of your mind. Look, that ain't going to, if that worked, I wouldn't have a job. Okay? I just wouldn't have a job. If lectures worked, I wouldn't have a job because every parent in the world has tried lecturing their kids out of their feelings. That's like trying to argue with a drunk person into sobriety. It just doesn't work. Sorry. Just make sure they're safe and teach later. Now, the second most important thing I'm going to say in this video is this thing that's outlined on the slide here, which is a 1-to-5 ratio. And here's what this means. 1-to-5 means for every one time you have to ignore, you have to walk away. You have to say, look, I love you. I'll talk to you later. It's your job, not their job. It's your job to look for 5 opportunities to connect with them later. Right? You remember that let sleeping dogs lie impulse? We're trying to fight that. You want to repair the relationship later because it's not the rupture that scars kids. It's the lack of a repair. So later you want to do something to fill their love bucket. I don't care if you use love bucket as the metaphor or love languages or whatever, but look for opportunities to reconnect with your child so that it's not about just ignoring your child. Instead, it's about them getting enough deposits to their emotional bank accounts that when you have to make a withdrawal, and you will, good parents have to make withdrawals, you're still in the black as far as the relationship goes. So it's your job for every one time you have to ignore, as hard as it is, when the child is not pushing buttons, to look for opportunities to praise. And afterwards, once you've gone back and you've looked for the 5 opportunities to praise, don't reminisce about the problem. Don't rub their face in the mud, right? And if you have to teach, follow a 30-second rule. This is the 1-5-30 that you see on the handout here, which means for every one time you have to ignore, look for 5 opportunities to reconnect. And then after, and only after you've done the 5, the magic 5, then you've got 30 seconds. And I mean it, 30 seconds to make your case. I've gone back and I've praised Johnny and everything's like that. And then I would say to him something like, hey, buddy, let's talk about what happened before. I just want to tell you where I'm coming from. Can I have just 30 seconds? Okay, Dad, what? And then make your case if you need to teach. And chances are the kid already knows what you're going to say. But if it makes you feel better, then you can do your 30 seconds. But notice how on this first one, there's no reason to punish the child. I mean, they wanted something and you said no and made sure they didn't have access to it. There's no reason to put them in timeout. There's no reason to do anything else because, they didn't get what they wanted. So this kind of preserves your sanity and it preserves your time as well. Now, you might be saying to yourself a few things, though. Like I said, I've been doing this for about 15 years, and here are the following concerns parents have. Okay, I said I'm not going to talk to you when you're talking to me like this. I'll talk to you later, and I'm walking out of the room. I'm making it so my feet are moving, Brian, like you told me. But what do I do when Johnny follows me? All right, time out. First of all, why is Johnny following you? It's because instinctively he knows that if you leave, so does his power. And so why not follow you and push your buttons, right? Look, you've said no and you're putting up the Xbox, okay? You're just making sure he doesn't have access to what he wanted. The only way he gets what he wants is if you stay in that drunk brain dance with him somehow. And that's why he's escalating. So if Johnny follows you, then you might have to occasionally say, all right, Johnny, I got to go into my room. I'll talk to you when you can talk to me nice. And then you shut the door and you let him freak out. Look, he's safe. He's not hurting himself or anybody else. So let him freak out and you can teach when the relationship is good. It's hard, but what's the alternative? And a lot of times parents at this point say, well, but I am ignoring him, right? But when you actually see videotapes of these parents, they don't have a very good poker face. When I say that you have to look at Johnny and say, look, I'll talk to you when you can speak to me well, you got to do it with a even tone of voice and a good poker face. You can't be like this. I'll talk to you when you talk to me well, right? Because I'm giving you all kinds of vibes that you're about to break me, right? So you got to be very aware of your body language. But what if other people can't ignore? Many of you have kids in the house in addition to Johnny. What if his siblings talk to him? Well, you may have to have a family meeting and say, look, we're going to do good voice, good face, good words for everybody. And anybody who pushes Johnny's buttons when he's in that place is going to share in Johnny's consequence. So what that means is in the moment when you say to Johnny, hey, can you please say that differently so I can stay? And the kids just kind of like push Johnny's buttons. What you got to do is you got to say to him, look, if you keep pushing his buttons, you're going to share in his punishment. Why don't you come with me? Or better yet, instead of engaging with Johnny in a drunk brain conversation, go find another kid who's behaving well and give them attention instead, right? Now, this last point is an important point, which is what if Johnny gets worse? Well, he's going to. I mean, he's going to. It's what we call an extinction burst. Extinction burst is the idea that things get worse before they get better. So let's say you go into your room and you shut the door and Johnny's outside your door, kicking the door. Annoying, right? Now let's say Johnny's kicking the door for a minute or so, and then you suddenly say, stop kicking the door. Well, the very next time Johnny's in trouble, how long is it going to take before he starts kicking the door? 10 seconds? Yeah. This is how kids get trained into extreme behaviors. So if you commit to this, you got to commit to it. Because otherwise, if the kid gets worse, and then that's what causes mom and dad to come back in the room and do the dance, that's exactly what they're going to go back to. Now, there are some situations that you can't ignore. If a kid says they're going to kill themselves, for instance, you can't ignore that. Now, you don't want to give it a lot of attention. So how do you find that nice line? Well, it's not perfect as far as my answer, but here's something to consider. If Johnny is claiming suicide, I think part of what you got to be able to do is you have to be able to say something like this. Look, Johnny, we can't talk about anything else if you're talking about hurting yourself. So I'm going to have you go into your room. You're going to have to keep your door open because every 10 minutes I'm going to walk by to make sure you're okay. But we can't talk about anything. Talk again in an hour. And if you still want to kill yourself, then I'll take you to the hospital and everything will be okay. All right. And you say as little as possible. You put him in his room. Make sure that the door is open. Don't engage in any other drunk brain stuff. And as you're passing the door, expect Johnny to try to engage you in the dance. Don't buy it. An hour later or whenever, when Johnny's calm, you go up to him and say, look, I can't talk to you about what I told you no about before, but are you still going to hurt yourself? Because if you are, I'll take you to the hospital. Make sure that that threat is off the table first before you go any further, right? We can't reinforce a kid for talking suicide, because eventually they'll start talking that way at school, and school can't ignore that stuff. They won't ignore that stuff. Now, I got to tell you, 90% of the time when a kid, especially in elementary school, is talking about suicide, they're just drunk, and that's all that's going on. So chances are when you go up to them in an hour, they're going to be like, no, I'm not going to kill myself. And then you can say, okay, thank you. Now that you're talking to me using good voice, good face, good words, what did you want to say? Okay. But there's that 10%. And that's why we can't call their bluff. We can't say, oh, well, you're just full of crap. No, we're not going to do that. But that's why we got them in their room. So that way, if they really are going to hurt themselves, when you go up to them in an hour and you say, hey, what you said was serious. Are you going to hurt yourself? And they say, yes, you take them to the emergency room. And if they won't allow you to do that, then sometimes you have to call the police. And you tell the police, hey, my son is talking about killing himself and he won't get in the car to come to the hospital. I need some assistance. And the police at that point have their protocols in place. It's not a perfect solution, but what's the alternative? Giving the kid attention for talking suicide? In the long run, that may not work. All right. Now, I've said before about doing that 1-to-5 ratio, and I meant it. So most of the time, this is about praise. Now, I want to say a couple of things about praise before we move on, and we'll probably conclude with a part 2. Okay. Here's a few points about praise. First, praise is more than just saying good job. Good job isn't a bad thing to say to kids. I just don't think it's very specific, right? So you can go back to the kid and say, hey, good job being with your brother. But I mean, that's kind of nice to hear, but Johnny may have no clue what you're really enthusiastic about. So you got to be specific versus vague. Look, if you have a boss and this boss says to you, hey, I think you're a super great guy. Well, that's nice to hear. But isn't it better if the boss comes up to you and says, look, I saw what you did on this project, and this is specifically what you did. You're an asset. Thank you. Doesn't that feel better? So you want to be specific about your praise. Hey, Johnny, I saw you interacting with your brother, and I know he was being really, really difficult when he called you a turd. And instead of you blowing up, you instead listened to him and said, oh, I'm sorry you're having a rough day. And that really meant a lot to me that you didn't blow up back to him. Thank you so much for that. That was very mature of you, Johnny. See, that's specific. Second, remember, praise doesn't have to be praise. It can just be curiosity. You can just be like, hey, what are you drawing there? Hey, tell me about that show. It's just curiosity is very connecting for kids. So instead of controlling them, we instead are interested in their world. We're curious about their world. This slide right here is what you do when you're doing that 1-to-5 thing I've talked about. You're being specific, you're expressing curiosity, and you're showing engagement with your body language. Hey, Johnny, I'll talk to you later when you want to be calm. Poker face. Versus, oh, that is so cool. Tell me about that, right? Which shows more engagement. You don't want to talk like you do with other adults. Hello, Bob. How are you today? No. Especially the younger the kid, you want to show some enthusiasm with your voice, especially if we're doing that 1-to-5 thing. And you know what? Do the kids' love language, not your love language. Your love language might be pats on the back where you physically get your back rubbed, but that could weird some kids out. Some kids, that's not their love language. They want something else. Find out what their love language is instead of assuming that they're going to respond to your love language. That's an important slide because it helps you understand what we're talking about when we're talking about that 1-to-5 ratio. Okay, so what I'm going to do is I'm going to pause part 1 now because for a couple of reasons. One, I'm running out of time. And 2, that's usually where I end the first session with parents, to be honest with you. Now, I know you want to know what to do when the kid is misbehaving, right? Hey, I get that. I would totally be right there with you with that. But honestly, what we've talked about a lot is a lot. Okay. And so what I want to do is I want to stop there. And before you watch part 2, what I would do is share this video with whoever is you're co-parenting with, so you're on the same page. Second, focus on that 1-to-5 ratio and how to disengage, okay? And then in part 2, I promise we're going to talk about commands, like when you want something. Because remember, up until now, the kid was the one who wanted something. So we can ignore, right? We can disengage, and then later we can repair, if we need to, the relationship and strengthen the relationship, because the relationship is so important. Look, the next part 2, I promise I'll talk about some consequences that you can use if they break a rule or if they're not minding or not dealing with transitions. But in all honesty, that 1-to-5 ratio is so fundamental. If that 1-to-5 ratio isn't happening, nothing's going to work. I've seen teenagers get sent off to military school out of spite because the relationship was that poor. So I think we first need to prioritize the relationship. And what we've talked about so far helps you get out of those drunk brain interactions, so that way you don't have to get stuck in that mud that really wears away at relationships. So focus on drunk brain scenario number 1, identifying when you're in a drunk brain scenario, and then disengaging. And then in part 2, we'll talk about some consequences that you can try out with kids, some of which will work, some of them may not. But all the things we've talked about so far have been backed up by science, and they have a lot of research behind them. So give them a shot. Let me know your comments if you have other ones, and I'll see you again in part 2. Thank you.